Good.
All right, so I've done my first med check at the Pyxis, pulling the Foley catheter out and getting the furosemide 20 milligrams. And I'm going into the patient's room. Hi, I'm Jessica. I'm going to be your nurse today. Let me get some energy. Can you tell me your name and date of birth? All right, Ivy Armstrong. 3964. Great. All right. And Ivy, do you have any allergies? All right. I do see latex there. Let me go ahead and get into your chart here. We're going to take a peek at the orders. Can you tell me where you are at today? Guilford School of Nursing. Wonderful. What day of the week is it? It is, yeah, you're correct, Wednesday. And I should have done this before I lowered that handle. All right. And Ivy, what are you here for? Okay, you came into the ER for diabetes, it looks like, uncontrolled. Looks like you're retaining some fluid, you can't urinate. All right, we're gonna go ahead and get you taken care of there. In the meantime, I'm raising this up. I'm gonna go ahead and flip on the lights, pull the curtains, give us some privacy. I do gotta raise you up high here. I'm a little tall. I want my sterile field to be higher than my waist. All right. And now that we're doing that, I went ahead and verified. So yeah, it looks like we have insert Foley catheter. We've got furosemide, 20 milligrams. Great for Ivy Armstrong. Second med check in the MAR. I went ahead and made sure that the Foley catheter pack did not have the latex in it because she is allergic to the latex. So I'll get all of this here. Ivy, I'm going to set that right there for right now, okay? Great. Let me do some hand hygiene. I'm going to do some gloves. All right, so Ivy, what I'm doing here, and I'll walk you through every step of the way as I'm inserting that Foley catheter. But it looks like we have retained some fluids, and you're not able to urinate on your own. So that that Foley catheter is going to go inserted in through the urethral medius, and we're going to insert it into the bladder. So it does have to be a sterile process. Your bladder is a very sterile organ, and we do not want to reintroduce any bacteria or introduce any bacteria to that. From there, I will put the furosemide 20 milligrams into your IV site. And that's a diuretic, so it's going to help with that fluid retention. We will go ahead and monitor you for any dehydration because with that releasing that fluid retention, we don't want you to lose too much. And then it can cause nausea, headache. So if you feel any of those, please let us know or let me know, okay? And we'll get you taken care of. All right. So I'm gonna have to pull your gown down because I am going to go ahead and assess your perineal area. We need to assess the skin for any breakdown, any discharge, and then, you know, are you having any painful, like when you were able to urinate, was it painful or anything? Is it okay if I lift up your gown here? Thank you. I'm going to make sure my trash can knew me, which it is. All right, so just do the 7 standards of care with the patient. And I did the second med check. All right, so we're going to assess this area. And it looks like I don't see any breakdown, skin breakdown, any discharge, no rashes, no abnormal like wetness or anything like that. So no signs of any incoming like pressure ulcer or anything like that. And while I'm down here, I'm going to go ahead and put your legs up. This is going to help with the catheter insertion. Alright, so we'll just leave that right there for right now. I know, not comfortable, but we'll get it over with. Alright, make sure your foot doesn't fall off there. Okay. And while I'm doing that, I'm gonna go ahead and clean the perineal area. So we're gonna wipe the farthest side away from me first. So we're gonna go top or front to back. And then we'll take a new spot or a new cloth and we'll do the same thing on the side closest, front to back. And then I'm gonna go ahead and wipe down the middle. And we're gonna go front to back. And this is just making sure that we're trying to get it as sterile as possible for you. I'm gonna throw it on my table here, my makeshift table. I've got my trash can. All right, so since that was not sterile, I'm gonna throw my gloves away and come around in hand hygiene. Are you okay? Wonderful. Lighting is okay. All right. So now comes the important part of keeping our sterile field. All right. Okay. So I can peel this, and I should not have done that with my hair. And then I'm going to start with the furthest away so that way I'm not reaching across the sterile field. I can right now because this is covering it. I can reach into the sterile, but I don't ever want to reach across and break that field. And you want to just touch that. Okay. And my gloves would be in here. So then I would take these. Oh, well, that should not have done that. The same thing with these. So just the borders. And open those up. I don't want to touch that sterile field. All right, so I'm going to start with my non-dominant hand going into my dominant hand. And I keep it up. And I can fix it. And then I do this. I go under the cuff. And put them on the wrong way. All right, so we'll do it like this. Okay, so now that I have sterile gloves on, I can go into the sterile field. Okay, so this is the first one that they say throw away. And I'm just gonna put this stuff over here. But normally I would have that bag that it comes in, and you can set it on the edge here to throw your stuff away. But we don't throw it away. Don't mind my gloves, just act like they're on the right way. And then I gotta make sure that that's already non-sterile. So, and that's non-sterile. I just broke it. Okay, so then it tells me step by step. So what I would do from here is I would take this iodine, squeeze it in there, and then I'm gonna grab this. So this, okay, this is the water. This is a lube. We're not gonna use that lube on the mannequins. So I'm gonna keep this part sterile. And then not, well, it's sterile, so I'm going to, okay. But I don't want to do anything with that right now because once that's in, that's going to be used to inflate. So I set it right here. And my cap. All right. So this is what I want to do. I want to not get in my sterile field. And I'm going to take my non-dominant hand and I'm going to place it and spread the labia open. All right. And then from here, what I'm gonna do is wipe, take the first one, go furthest away, and I go front to back. Don't rip it. I think she even said that she doesn't use that, right? Mm-hmm. That's probably why. Okay, and you throw that away. Your second one is front to back, throw it away. This one is in between. Okay. And then I'm gonna break sterile field because I'm gonna get the lubricant because it's different than what's in here. We can't put that on there. And I'm gonna put 3 to 4 sprays. I'm gonna get rid of this too because that's not fun. Okay. All right, so I am, these are kind of hard. All right, so I am going back into sterile field. So the thing is I just don't want this thing to be flowing around. All right, so I'm gonna lube it, lube it, lube it, lube it, lube it. All right, Miss Ivy, we are going to get this pushed up. I would not do this because, but my, okay. What I'm gonna want you to do is, as I'm inserting, I want you to bear down like you are voiding, okay? 1, 2, 3. Go, 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 go. All right, and then whenever I see urine, I'm gonna go ahead and advance it 1 to 2 more centimeters. All right. And then I'm gonna go ahead and fill this up with the 10 milliliters to inflate the balloon. I want it to make sure that it's not in between, that it's actually in the bladder, which is why we advance it 1 to 2. And then I'm going to tug on it, make sure it doesn't come out. I'm going to take this off, obviously not recap it. And then I am going to just clean it up again because it's gonna have that eye line. So I'll just clean just the same way. From top to bottom, outer, top to bottom, middle, and then the thing. And then I'm going to take this and we're going to make sure that it's not up, and this will go in, this white Y part will go into the Y right there. So I'll put it, a lot of times we'll put it on the upper part so that way it's not rubbing. So I'll make sure that when your legs come together, it's not rubbing. And we don't want it stretching. So I'll take that and then I will hang it. And I will make sure that when I'm hanging it, it does not go and touch the floor because we don't want that. So we'll hang it. Oh, does that feel good? I mean, I'm sure the insertion didn't, but I'm sure relieving does. Okay. So that is that. We'll get this all cleaned up. already taped up to her leg. All right, and I'm gonna throw this the way that we keep it at Goldfarb. And I'm gonna come around and do hand hygiene here. All right, Miss Ivy, you are a trooper. All right. In dental school, we called it hot hands. When your hands sweat from like putting on, off the glove, so it's hard. Okay. All right, so the next thing we're gonna do is make sure, it looks like we do got some urine coming out, good job. And then we will, I'm gonna administer that IV, or that loop diuretic. So again, that's gonna help with that water retention. With that, as it does relieve that fluid buildup, let's go ahead and get you. Okay, but I'm gonna go ahead and take this out but I would deflate it. And then I would say, take a deep breath in and blow out, and I'm gonna pull out. And then let's go ahead and get you covered up, okay? All right, so with that loop diuretic, it's going to do all of that for you. Help with the water retention, the fluid retention. All right. And it's very easy. I'm just going to administer it right in your IV already. I'm going to get my supplies here. I'm just going to lay them on the side of the bed. All right. We've got your Ivy. Can you verify your name and date of birth for me again? I'm going to scan you in here. Great. Ivy Armstrong, 3964. Allergy to latex, correct? So I would scan it. Then I would go in, do my third med check, scan that. So we're administering furosemide, 20 milligrams into your IV for the fluid retention to help with that. When that kicks in, it will also lower that blood pressure. And then we'll monitor you for dehydration because we don't want you to lose too much. And then if you get any nausea, vomiting, or any nausea or headache, let us know, okay? All right, so I've got that. And I've got my 18 gauge needle and my 3 to 5 milliliter syringe. So let me get my alcohol wipes, and I got a cotton ball and some tape. Oh no, no tape, or no cotton ball, sorry. All right. Okay, we're gonna try not to spike this to the ceiling like that. Like a waterfall. Okay. Let's first go ahead and get your meds drawn up. 28, 29, 30. I'm gonna act like this is my table here to drop the meds. While that's drying, is sterile. All right, so I'm gonna go ahead and pop this. And since they want 20 milliliters, so it's gonna be this full vial. Well, 20 milliliters or 20 milligrams per liter. So we're gonna pull up 1 milliliter. That's what I meant. All right, so I pulled back 1 milliliter of air. And I'm gonna go into the vial and I'm gonna push that down and try not to shake all over the place. All right, and then I'm look it up. Make sure my needle's in there. And this I can. So I want to make sure there's no bubbles in here. Okay. All right, and then I'm gonna safety that. I'm going to pop it off. Where's my cap? That's okay. This is going into sharps right away. And then I'm gonna take this and I'm going to grab this and I'm going to keep it very sterile. 28, 29, 30. Make sure this is unclamped. I need to pull back. Make sure I see blood return. We can actually go into these, can't we? Okay. So I'll do 1 to 2 milliliters of flash. I'll take this off. All right, so with the medication, I'm gonna make sure that's off. And I've got 1 milliliter, so I'm gonna wanna administer it over 1 minute. Okay, so 1 minute went by, I administered it. I'm gonna go ahead and take that, and since this hit the bed, I'm gonna hold this and I'm going to wipe it with a new thing for 28, 29, 30. We don't need any of that. And then I'm gonna go ahead and over a minute, I'm gonna administer this other flush, or this other sterile solution. But do it at the same rate that I administer the medication. And then while I'm doing that, I'm gonna positive pressure clamp it off, so that way there's no backflow. I'll do this, and then I would tape it up again, or put it back in here to make sure. All right, Ivy, got you all taken care of. So I'm gonna come back and check on you, check out your parents, see how everything's going. Like I said, those adverse effects of that loop diuretic could be, you know, dehydration. So I'll make sure to monitor you there. I'm gonna put you down, and then, you know, a headache, nausea. So if you start to feel any of that, please let us know. I'll come over and put the call light there. Would you like the lights on or off? You want them off? Okay. And then do you want your head up, or do you want it just like that? Okay. And then whenever I do leave, would you like your door opened or closed or halfway? Okay, you want it closed? All right, I'll leave your head like that, but really I'm not going to. Great. And you want the lights on, okay? I'm gonna make sure that I am locked out so nobody can get into my charts. All right, Ivy, let me make sure you have your, I would clean all of this up. Let me make sure you have your call light here. All right, if you need anything, just give us a call, okay? And I'll be back to check on you.